So, good evening, friends. Welcome back to yet another new episode of Diabetes Patient Education series. Friends, we all know that it is very important to learn the self management of diabetes as it is a chronic disorder and it is going to stay with us forever. Even if sometimes we reverse or get the diabetes to remission phase, still we need to take care of ourselves to keep in remission or to keep it in reverse stage. So, friends, we have to learn the self management of diabetes, and it is very important, friends. I am your diabetes well-being coach, the director of Masterdoctor Wellness Clinic, Dr. B. Jagadish, your host tonight. So friends, today in this video we are going to learn about 5 tips to better the self-management of diabetes. Friends, this is the most important thing which I always stress upon to my patients. That is the importance of self-management. So proper self-management can not only help improve your blood sugar control, but also it helps reduce the risk of the complications, and it improves the overall quality of life of a diabetic patient. So friends, without further ado, here are my 5 tips to better your diabetes self-management. The first and foremost thing is to know your numbers. So it is very important to regularly monitor your blood sugars, maybe with the help of a glucometer, with the help of like in a lab, or you can take the help of like the CGMS device or CGMS sensor, continuous glucose monitoring, which comes in 7 days and 20 days. Even some are there which can measure your blood sugar continuously for 90 days. And there are some older versions which are actually invasive, but these are non-invasive methods or mildly invasive, very minutely invasive methods. And we always advise the patient at least to do 2 tests in a month, one fasting value and one postprandial or random value. Apart from that, every 3 months you need to check your HbA1c. That will roughly give you the overall diabetes management over the period of last 3 to 4 months. And apart from that, you need to know your blood pressure. Measure regularly so that you will have it under control, and if there are fluctuations, do talk to your diabetologist or your physician. It is very important with diabetes to get your blood pressure under control. Along with that, few other parameters like lipid profile, kidney profile, your thyroid profile, once in 6 months or once in a year you need to check those, because our aim to check and to keep our end organ damage at the minimum and to prevent those. And while you know your numbers, you will be more confident, and it will help you understand how your body is responding to different foods, to your medications. So it will be very helpful, friends. Then coming to the next, always, as diabetes is a lifestyle disorder, so we need to work on our lifestyle. So the next 2 points will be like eating a healthy and balanced diet in addition to doing regular exercise. So with the balanced diet, what do we mean? We need carbohydrates, especially for immediate energy, so we need that. Even diabetic patient needs to calories to run day-to-day life works, but it should be in lesser quantities and depending on the energy expenditure by you. Okay, so you should choose the foods which are high in dietary fiber and low in saturated fats and complex carbohydrates loaded with dietary fiber. All these things will make, and also include good quality proteins, that, and that makes a balanced diet. Include more of vegetables, green leafy vegetables, some fruits in your daily diet. That will keep your blood sugar under control. It will get you all nutrients, macro and micronutrients needed to run your life on a day-to-day basis. And as I already told you, the second or the third point here, and the second point in your lifestyle modification, yes, my friends, exercising regularly. That's a very important part of your diabetes self-management, and usually we advise to do at least 30 minutes of aerobic exercise, including walking, jogging, running, cycling, doing any yoga, swimming, aerobic drill exercises, cardio exercises, pilates, whatnot. Any form of exercise is beneficial in diabetes, not only to keep your blood sugar under control, rather to improve the blood circulation. It will prevent the complications, and also it will help the improve the blood circulation, so that your all the body cells get the food, all the nutrients, all the oxygen, and all the excreta will be filtered out. And in addition to that, my friends, doing exercise helps us to keep our muscles, bones and joints fit, and it will keep up our stamina, our all the energy. So it is very important. And in addition, it is advisable if you can add some muscle training, strength training, vigorous exercises up to, like, let's say 75 minutes in the whole week. So daily it comes around like 10 to 15 minutes, that's all. So we know now that exercising regularly is a very important part of diabetes self-management. So moving ahead to the next point, taking your medications as advised by your physician, not over the counter, friends. Do not do that. Do not use medications other than advised by your physician. And always, whenever you something happens, you consult with your physician. The tablets you need to check with your physician. Do not take over the counter. It might harm you, if not in short run, but in long run. Please do follow this advice, my friends. And always take the medications on time. Okay, do not someday you are not taking, you are not feeling good, you are not taking, someday you have skipped the meal, So you didn't take, someday you did fasting. So it is not at all advised, because it will create fluctuations, and all the fluctuations in your body is going to harm you in long run and short run, my friends. So do remember to talk to your physician what to do if you are keeping fasting, what to do if you are sick, and also ask regarding hypoglycemia, what to do then. And visit your physician regularly, so that and keep on checking, so that you will be able to keep your blood sugar control with minimum number of medicines, avoiding the complications. So it is very important to take your medicines as prescribed by your physician regularly without fail. If you are traveling, do prepare well beforehand. Keep your medicines and other, like if you're taking insulin, like insulin cartridge, insulin cool pouch, insulin syringes or insulin needles, all those things, check it beforehand so that you do not miss your medications. So moving to the last but the most important again, do not forget the screenings. By screenings, I do not mean no blood tests. By screenings, like you must screen your diabetic feet, your feet every year. It's very important, friends. Some people think what will happen in a small ulcer, it will heal on oneself. They to keep on taking some sort of local therapies, some suggested by some friends, some relatives, some medicine shop wala. So they keep on experimenting. Finally, they land up in a problem and they go to a physician. When most of the things are gone from the hand and nothing can be done except amputation, my friends. So it is always better for prevention. So you check your feet at least once in a year, and with your podiatrician or your physician or your diabetologist. And in addition, daily you do the inspection of your feet while you are going to sleep. Just check your feet manually if there are any cuts, any wounds, anything, because then only you will be able to catch the things early. And the sooner you treat, the earlier you treat, the better it is. Okay. And then you can, like, do ECG. You can do, like, fundoscopy to check your retina. My friend, it is very important. Sometimes there are no symptoms until it is damaged irreversibly. So it is always to check. Once in a year you can do fundoscopy. And blood pressure, that's a non-invasive, you can do the ECG once in a year, once in 6 months. So these are the screenings you must consider. So friends, we discussed today 5 tips to keep your, like, to better your diabetes self management: knowing your numbers, eating a healthy and balanced diet, exercising regularly, taking your medicines in time, and number 5, screening regularly. I hope these tips are going to help you on your journey to better diabetes self-management. Remember, the key is to educate yourself, monitor your numbers, your parameters, your blood pressure, your blood sugar, and other things regularly, eating a healthy, balanced diet, exercising regularly, being physically active or daily, without fail, and working closely with your healthcare provider, with your physician, with your podiatrician, with your diabetes educator, with your diabetic nurse, with your physician assistant, whoever is available according to your place. Please, this is going to make your life easier to live with diabetes. So with a little effort and determination, you can take control of your diabetes and live a happy and healthy life, my friends. So I hope you got the tips and you are going to implement, and already many points you are successfully implementing into your life with diabetes. And do let me know which points in the comments box. If you are following which tips, just mention here. If you are not following which tips, also mention that. And what are the difficulties in following, please do let me know in the comments box. I would love to interact with you, answer your queries, help you out there. Remember, my friends, I'm always there. I'm your friend, Dr. Jagadish. I'm a diabetes well-being coach. I'm there always for you to help you live a happy and healthier life with the diabetes. Thank you, my friends, for your patient listening and being there with me. And if you really like this video, please do hit the like button and share your feelings and thoughts in the comments box. And do share this beautiful piece of information with your friends, with your family, with the relatives, and with your neighbors on your social medias. Sharing information is caring. Sharing is caring, my friends. And for more of such information, you can always subscribe to our YouTube channel, Masterdoctor Wellness. Please hit the bell icon to get the videos at fast when we load anything. And thank you for watching this till the end, and hope I am successfully, given you the tips to better diabetes self-management. So bye for now, friends. See you with another amazing topic on another day. Thank you and good night. Bye bye.
Let's learn about better self-management of diabetes.
Know your numbers, monitor your blood sugar levels, and track them in a logbook or on a smartphone app. Eat a healthy, balanced diet. Foods high in fiber, low in fat, and rich in nutrients. Exercise regularly. Help lower blood sugar levels, improve insulin sensitivity, and reduce the risk of complications. Take your medications as prescribed. Don't forget your